Hello, everyone, and a huge welcome. My name is Grace Leary, and this is the Carnosine Q A. So tonight we are broadcasting live across multiple platforms. So happy to see you here, and welcome if you are watching the recording. I love these Q&As because it gives people that are having a wonderful experience with this carnosine gel that everybody's talking about a chance to speak to an expert and ask questions about how they can most effectively use the gel. So we're going to dive into some questions that we've had coming through. Please drop in a comment where you're tuning in from, if you're on Instagram, Facebook, or YouTube. I am a busy mum of 5, and I have been loving introducing carnosine to my daily life. I literally used it on my daughter's achy legs. I used to get them as a child, growing pains, and it works a treat. So more and more, I'm just loving the benefits. And that's why we're here today. These sessions are to educate all of us on the power of this miracle molecule. Just an important disclaimer before we dive into the questions. The content of this session is provided for educational and informational purposes only. So it's not intended to be professional medical advice, diagnosis, or treatment. You should always seek advice from your medical practitioner. But let's get on. Dr. V. Dr. Willie Villarreal is a longevity medicine expert, and he has a Houston-based clinic based in Houston, Texas. And he helps people reach their highest potential, no matter what age or stage or ailment. He's there with the forefront of medicine and everything to keep everyone feeling their best, their most vital. So welcome, Dr. Villarreal.
Hey guys, great to meet y'all again. Hi Grace, how are you doing? Can you hear me? There you go.
Yeah, I can hear you.
Awesome.
I'm really well, thank you. I'm excited that we've got this opportunity to be able to ask a health professional like yourself that is actually using this gel with clients and getting real results. So I'd love to start off. Could you explain to people that are maybe hearing about carnosine for the first time how it works from a clinical perspective, and particularly the gel and this application process that we've now got our hands on?
Yeah, thanks for having me on again. I love doing these every Tuesday or every other Tuesday. I've been blessed to have been using this or been exposed to this for over a year now. So I was one of the early adopters. And we've seen a lot of the applications that we're using it for, and the applications just seem to keep growing every day. It just seems like there hasn't been a single thing that we haven't seen it benefit. But from a basic standpoint, what is carnosine? A lot of people don't actually know what it is, and it's very easy. Carnosine is just a naturally occurring dipeptide made of 2 amino acids. It's just basically beta alanine and histidine. It's found in very high concentrations in skeletal muscle, heart muscle, brain tissue. If you eat meat, you're consuming carnosine. Okay, your body also makes it. It's going to have 4 primary biological roles, which are, if we tap back into, we can get real sciencey about it, but tonight I'm just going to kind of keep it pretty basic so people can understand. But there's 4 major pathways which are going to impact a lot of its use, or the reason that it works so well. And its 4 primary biological roles are going to be buffering lactic acid in the muscle, so it helps neutralize lactic acid. It reduces oxidative stress. It prevents protein glycation, or what we call the formation of anti-glycation end products, or AGEs. And it supports cellular repair. So in simple terms, basically, carnosine protects tissues from metabolic stress. A question I get almost daily is, why haven't we heard about it? This is so great, and you talk so highly about it. Why haven't we heard about it? There's 3 main reasons. It's not patentable. So just like a lot of other supplements and other substances in medicine. Like it's not patentable in its natural form. So carnosine, we've known about carnosine for about the last 100 years. It was discovered in 1900, but because it's naturally occurring, it hasn't attracted the same kind of pharmaceutical marketing machine as synthetic drugs. Secondly, its oral absorption is limited. So we've never had the technology. So when taken by mouth, carnosine is rapidly broken down by an enzyme called carnosinase, or CN1, in the blood. So historically, systemic bioavailability has been inconsistent. I mean, it's just not going to reach the target tissues. Most of the research lived in kind of academic circles for decades. Like carnosine was studied in aging research, primarily sports physiology, which is well known in neuroprotection, and then glycation science, but it wasn't really translated into practical delivery systems. So what changed? The technology improved, just like with everything. Think about your landlines, and now we have a computer in our fingertips. As with anything, technology is improving at a rapid pace. So now, instead of relying on oral supplementation that gets degraded quickly, we have a topical absorption technology. So we own the patent. The patent with Lactigo is patented. It's a patented topical delivery absorption technology called ethoderm. And basically it allows a few things: bypasses the digestive breakdown. Okay. It avoids first pass, metabolism in the gut, sustains local tissue concentration. So literally we can get high, 100% muscle tissue saturation in 30 minutes, or less in some cases. Direct application to the area under metabolic stress. So we can apply it directly to the target tissue. So, and then it has, a couple of, penetration enhancers, and synergistic compounds. So carnosine it's coupled with a magnesium sulfate that's in it, which, is commonly known as Epsom salt. Epsom salt is the same, formulation in Epsom salt's magnesium sulfate. So there's faster tissue uptake. There's local buffering effects. You can get the anti-glycation activity exactly where it matters, and there's rapid. One thing that you're going to keep hearing over and over and over is rapid symptomatic relief in the muscle and tissue applications. Exactly where you put it on, you get actually very, very quick tissue response. So this is why patients are reporting, noticeable effects quickly, sometimes in 5 to 10 minutes. But you're delivering the molecule directly to the tissue instead of, hoping it survives digestion. So overall, basically, the easiest way you can think about it and sum it up is carnosine is just one of the body's natural protective molecules. It buffers the lactic acid, prevents the sugar damage to the proteins, protects tissues from metabolic stress. And again, it's not new. We've known about it for 100 years, but only recently, have we had the delivery technology to actually get it where it needs to go. So I know y'all had some specific questions.
Yes.
You have those available, Grace?
Yes. So that's just amazing. It blows my mind how many ways this is helping people. I'd like to kind of hone in on injury. And that's something that you deal with a lot.
Mm-hmm.
So we've had some questions come in about how to use this gel pre and post operation.
Mm-hmm.
So I'd like to ask, have you observed or are you aware of when carnosine is used, the carnosine gel has been used before surgery, and what benefits might that bring someone that's going into an operation with an injury?
Yeah. So real quick background. My first love, my background is surgical. So I started my medical career at 19 years old as a surgical technologist, and then kind of moved up the ranks. And I was a surgical first assistant, finished my bachelor's in nursing, and I was an RN first assistant for many years. And I specialized in open heart surgery. That's actually what moved me to, where I live now. And I worked with a very advanced open heart team, and I was the one that actually did the vein harvesting. I would draw the vein harvest to draw the saphenous vein from the leg to prepare it for bypass. And I was always up to date on technology, and I always wanted to be at the kind of the forefront. which led me to now further. I was in, I worked with a very, very good orthopedic and sports medicine um, surgeon, and then now I do robotics primarily. So I'm in surgery. I've owned a surgical company for over 25 years, so I'm very in tune with all surgical tech, and but now being in the clinical setting, it's very easy to apply, and now that we have this, I've seen some amazing pre and post-op recovery. So pre-op, we're seeing, the two components, carnosine and the magnesium. Again, we could really go into the science of why that works, but basically, um, I recommend it to patients, to start it about 3 to 7 days pre-op, apply around, and near the planned surgical site, at least twice daily. That is what you're going to find is the sweet spot. AM PM is minimum, for like an acute injury or acute surgical site. Ideally, the sweet spot really is 3 times a day. But the potential physiological benefits stem from it's going to improve the local tissue metabolic resilience. It's gonna like really give them a good head start in the healing process. It's going to reduce the baseline muscular tension. So depending on what they're working on, especially if it's like an orthopedic injury, a total hip, total knee, an ACL reconstruction, just even if it's just a arthroscopy of the knee, or like for a meniscal tear, anything, it's going to help. It's going to optimize tissue buffering capacity, and it's going to reduce a lot of the peri-op and post-op soreness that they're going to have. So I would, have them use it up until, the night before surgery. And usually, because of so much going on during surgery, they don't really apply it, the day of surgery. But I would have them start applying it post-op almost immediately. And the big issues with post-op is, you don't want it in open wounds. You don't want it, into fresh incisions. Um, you can, as long as it's after the dressing is off post-op, you can apply it directly to the surgical site. There are surgically, just we've used carnosine for really bad decubitus ulcers. Those are commonly known as bed sores, which they can get pretty bad. I mean, we've seen people's tissue eaten all the way down to where they have exposed, sacrum, exposed, backbone, actually, where it's eaten all the way down. And there are carnosine infused colloidal gel dressings that have been around surgically for many, many years. So from the medical surgical standpoint, like, we've known about carnosine for many years as far as a healing agent. I just wouldn't put it in an open or non-healing wound. But from an aesthetic standpoint, we've seen, and I showed pictures from a surgery that we did, post-op, pre and post-op, at the office, where I had them start applying it to a laparoscopic incision, and within a few days, you couldn't even really see it unless you were looking for it. But it can sting initially, to some wounds, but that's going to be mostly because the nerve endings are fresh. There's some, the nociceptors are kind of, fresh, and there's a lot of like prostaglandins and bradykinin, like, just receptors that are open. And so it can be a little, especially like, on any kind of like road rash type, or a scrape. Just, be careful putting it on an open wound. But I would have them start using it, pretty quickly post-op, as long as it's closed, dry, and there's no drainage coming out from any of the post-op wounds. So the quicker you can get it post-op, the better. A lot of physical therapists are using it. I have a big group of physical therapists using it, and one of the things that we notice with physical therapy groups is that if you think about the average, if it's a 60, 70, 80-year old that has suffered a fall or had a total hip replacement, now they're having, PT. Well, they're already their muscular resilience and their activity levels are already kind of compromised, so they don't handle PT very well. And the surgery part, anybody that's been in surgery, the surgery part is honestly easy part. Most of the time, it's the recovery afterwards that's a hard part, and we just found it's just an amazing tool to help them post-op, so they won't have as much uh, peri-incisional inflammation. They won't have as much tissue stiffness or muscle guarding. It'll make their PT go a lot quicker.
So
And
what's PT?
physical therapy. So their physical therapy right afterwards
Yeah.
will be a lot smoother,
Hmm.
um, and they'll be able to handle it, and then they'll actually be able to come back sooner because they recover better, and they can handle the the exercises that the physical therapists are actually giving to them. So
Okay. So for someone that doesn't necessarily understand when they have an incision and a wound and muscle tears, what's happening in the body and how is carnosine helping their recovery? What's it doing? What's it doing in the body to help recovery? You mentioned inflammation, but could you talk about what it's actively doing a little more?
yeah, so everybody always talks about inflammation as being a bad thing, but that's our body's natural healing process. So I mean, you want a little bit of inflammation, right? But the way I talk about inflammation for with patients is that a little inflammation is good. Like think about it like fire. Like a little bit heats your house, right? Cooks your food. Too much burns your house down, right? So we want a little bit of inflammation, and that's what happens with surgical wounds. You'll get a little bit of inflammation, but that starts the healing process. A lot of the newer modalities, like for healing, say like prolotherapy, which is an injection that you do of like a saline, really really powerful saline base, and what it is, it's causing a localized inflammatory response, so the body throws healing, healing factors at it to where it heals quicker. So inflammation is not always a bad thing as long as it's controlled. So anytime there's a fresh surgical wound, you're going to have a little bit of inflammation, but applying the carnosine tamps that down. You don't want the inflammation to hinder recovery to where they have too much pain and they don't have good mobility. And when we're talking about specifically, say like a total knee replacement, honestly, the surgery, it's not easy, but it's the easy part. The recovery for a total knee replacement is what'll make or break the outcome for that surgical patient. So they can end up with a flexion contracture and a permanent limp if they don't do proper physical therapy and don't have proper mobility. And the carnosine just helps them have an easier physical therapy experience. So it'll have it'll help with the healing process and the wound healing process, and even honestly the incision process. So the incisions actually look better. There's a lot of studies. If you just literally type in carnosine and like wound healing, there'll be a ton of studies that pop up as far as like helping with scars and things like that.
Amazing. So for someone that's wanting to use it on a targeted area post-op, how would you recommend to apply it for best results?
Like I said, as long as the wound is closed, minimum twice a day, but you can't use it too much. Like I said, it's just an amino acid, so there's no upper limit. You can't apply too much of it. There's no contraindications. That's what I love about it medically. There's no contraindications. There isn't a single person that can't use it. And there's no age limit, so that we're using it on kids, teens, that are in baseball academies or volleyball clubs, or all these kids that are being exposed to um, a lot of repetitive, training early. If you look at like baseball, some of these kids that even if they keep them on a pitch count or whatever they want to claim on baseball, the number one group of kids getting or males getting what we call Tommy John surgery, elbow surgery, is age 15 to 19, and that's crazy to me. It used to be when they got into the, college or pros, but we're using it on, teens all the way up to elderly. There's not a single, you know, ideal group, and there's not a group that can't use it. So it's usable across the board for every single age group.
I mentioned earlier that I used it on my daughter's growing pains, and I suffered with that as a child. So could you explain to me, because I'm so curious, why that helps her?
Well, because it's going to tamp down, just plain and simple, is going to tamp down inflammation. So the magnesium sulfate itself, right at the target tissue, it really calms any kind of neurovascular inflammation. So any kind of pain, the nociceptors, we have what we call nociceptors in our tissues, and we have a lot of inflammatory cytokines and things that happen, but basically it will tamp down immediately any kind of inflammation. um, Inflamed tissue or damaged tissue, or what we call itises, right? Any kind of inflammation of, um, they're by nature acidic. Okay, they're mostly gonna be acidic, and that's where the carnosine is magical, because the carnosine buffers the acidity, the hydrogen ion. So a hydrogen actually, from an exercise standpoint, right? Any kind of intense repetitive exercise, our body starts pumping out hydrogen ions that drop the pH, that causes the burn. Well, it's the same effect in inflamed tissue. Our bodies pump out hydrogen ions, and basically that is causes the pH to drop and causes the burn, causes some of the pain. Well, the carnosine buffers that intracellularly, and it doesn't allow those hydrogen ions to be pumped out. So it actually prevents or extends out the fatigue. If you're doing a training or an exercise, it either pushes it out further, and it pushes out the onset of fatigue further, or it just also helps with just recovery after training. But from an inflammatory standpoint, like the growing pains, that's just going to be that's a deep bone pain that's very, very, very hard to get to. It's the kind of the same thing you see kind of with shoulder surgeries. One of the most painful you can have, because it's like a pain that you can't get to. It's like this deep kind of throbbing bone pain.
I
And
have a question actually that's come
uh,
in from YouTube about frozen shoulder as well, as you're mentioning shoulder.
yeah, so frozen shoulder is very difficult sometimes, depending on how the extent of the frozen shoulder, how long it's been like that. Sometimes it does require physical manipulation under anesthesia. And it can sound pretty gnarly. Yeah, I mean, we've done a few of those. Whenever I was working with an orthopod and orthopedic surgeon, and we'll put them to sleep, and it's just like loud snap, crackle, pop until we get full motion back, because you're basically having to break up scar tissue. And this would be an amazing application to now. Once the frozen shoulder is there, like, it's very hard, is very, very, very difficult um, to like, I wouldn't say that the lactic at that point will use it. Now it'll help with pain. It'll definitely help with pain. But as far as like actually breaking up scar tissue, that a lot of times is going to have to be done manually, depending on the extent of it. But you could literally start using it pre and post op to help start relaxing the surrounding musculature. And then for sure post op to actually prevent the frozen shoulder from coming back, because that's one of the biggest fears, is like doing it, releasing the frozen shoulder, but then having it come back because of lack of mobility. So we say motion's lotion is
Yeah,
one of the things that we
it's
say.
amazing as well, because I've suffered a motorbike accident, and it really is the things that you can do consistently when you've got an injury, because you can't be in getting manipulation and physiotherapy all the time. So
Mhm.
this is just such a great tool to be able to do consistently. I
Yeah,
wish I had
and
my accident.
I still to this day continue to forget to use, I'll sit there and I'll be doing something, and I'll say, "Oh man, this hurts," and my wife will just be like, "Why don't you put Lactigo on it?" And I'm like, "I
Oh
don't know."
my
Yeah,
gosh.
and so real cool stories. This weekend my wife and I were at Disney World together. We decided to go. It was the first time that we've gone without kids, and it was just like it was for Valentine's Day. She and I went. Anybody that's been to Disney World knows that the first day of walking, especially even if you have good shoes, the end of the night, your feet feel like they're broken, and you're walking 13, 15 miles a day. And so this time was really, really cool. And in fact, I took a picture. I'm about to make a post about it. But I applied the Lactigo, to my feet and my legs before and then after, and didn't feel the pain that we had felt in the past. I mean, it's for real. It doesn't matter how good a shape you're in, and I would consider myself to be in very, very good shape, but your feet still hurt at the end of a long Disney day, and this time it was great. So this is something that I will never ever not use again. So
That's a good tip as well. Holiday, don't leave
yep,
home without it.
yep.
Welcome to everyone else that is joining. Please continue asking questions and pop in where you're tuning in from. We've got a few more minutes with Dr. V. You mentioned pain before.
Mhm.
So I'd love to know what is carnosine actually doing in the tissues when people are experiencing pain relief? You mentioned, so it's inflammation. Is it
Yeah.
masking the pain in any
No.
way?
No, and that's one of the beautiful things about it is it's not like a pain gel like a Voltaren or any of these over the counter that are just strictly pain gels. They're kind of localized anti-inflammatory. So it is working at the cellular level to prevent the hydrogen ions from being pumped out. So it helps by reducing the oxidative stress, what we call the ROS or reactive oxidative species. It's really, 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 like I said, it's a new technology. It's not masking anything. So that's one. I get that question all the time from patients. So am I just masking? Am I just going to keep hurting myself? I'm like, no, no, no. It's gonna start healing tissue. So let me rephrase. It doesn't heal tissue. Okay, I've got to be real careful about that. It helps. It's gonna allow the body to do its work, but it's going to do it in a much more comfortable way. That's kind of the best, easiest way to describe it. Like I said, we could get real, real, real deep into the science. I that would be the time for another, like a Tuesday night talk, a specific like deep dive on the actual um, uses of it.
Hmm.
But basically, those are going to be, the main way it works is it like cellularly, like I described earlier, the four major metabolic pathways. It's going to reduce it's going to buffer lactic acid. It's going to, reduce the metabolic stress in the cell. It's going to reduce the AGEs, the anti-glycation end products, which are pretty damaging to tissues, skin, vessels, everything, you can think of. So those are the main pathways that it's gonna work. But overall, it's just it allows the body to heal quicker and do its job better with less pain.
Our body is truly amazing, and I'm loving learning how this is just helping how our body do what it's naturally designed to do,
Mhm.
but better.
Yep.
So there's a couple of formulas. There's a menthol and a non-menthol.
Hmm.
Um, should people, we've been specifically talking mostly about post-op and pre-op. Should
Hmm.
they use the menthol and the non-menthol? What about, on scars themselves?
I would not use menthol on any scars at all. I would use the regular. If it's a closed injury, like non-exposed, if it's like a laparoscopic or it just still be hard to use it like an arthroscopic surgery of the shoulder where there's just tiny holes. Maybe what I've learned personally, what I've seen clinically is that it's real 50-50. patients really either like menthol or right away, I'll always show them both. And right away they'll say, oh, I don't like menthol, or, oh, I love menthol. So either way, it's a very personal decision. For acute joint pain, I always recommend the menthol. If they don't like it personally, I'll say, hey, the regular one works just as well. But the menthol has that extra kind of like pain relief cooling effect, kind of like biofreeze. It doesn't have a long lasting lingering smell like Bengay. You're not going to smell like Bengay the rest of the day, or any of these other menthol related products. It's a real mild menthol, and then it goes away. You don't really smell it after that. But I personally like, every night I put the menthol on right before bed. I'll put it on my lower back or legs. I like the way it feels like on my thighs and my calves, and I'll put it on my feet, and it has this like kind of cooling effect for my legs, and it helps me stay cool, or at least helps go to bed. I like the way it feels. And it feels great, but it's going to prevent those hydrodynes from accumulating. And it just overnight, I mean, and it's cumulative. You don't have to, I know we keep talking about for pain and things like that, but we could do a whole other Tuesday on the longevity benefits. So there's a lot there's a reason. If you look up carnosine, they call it the longevity molecule for a reason. So I urge everybody to, if you just type in carnosine and anything you want to know about, there are over 3,000 studies on carnosine,
Yeah.
from
Well,
everything you can think of.
I've used the non-menthol. I did use menthol once, and it's not a great idea near your eyes, but I use it on my face, and I'm loving it for the longevity. So we will get you on again. We've run out of time now. We've got one last question. We'd love to talk about those longevity benefits even more, because everyone's interested in that. So how does this, or would this compare to BPC 157?
Okay, so BPC 157, we've used that clinically for a very long time, but it involves an injection. You'll hear about oral BPC being used, oral BPC 157. So BPC 157 is a 15 sequence amino acid. So, that's, we're talking about carnosine being a dipeptide. It's 2 amino acids, right? BPC 157 is a much more complicated. It's a 15 sequence amino acid, and it's derived from our gut. But the thing about it is that it generally requires, to be optimal, it requires an injection. And that's going to, knock out a lot of people that are like, no, I'm not going to inject. And ideally, you want to inject once or twice daily. Oral BPC 157 is actually a very, very good product for anybody with gut issues. So any kind of IBS, IBD, which is irritable bowel syndrome, with diarrhea, or irritable bowel syndrome with constipation. There's different forms. Any kind of it's been used for Crohn's, and it's been used for celiac, and any kind of ulcerative gut issues. Oral BPC 157 is best, and there's a lot of really good studies on its healing properties. But the difference with BPC 157 is that it's injectable, and it can go systemic. You can do it subcutaneous injection. You can do it near the site of injury. It doesn't have to be right on the site of injury, but it's going to differ completely, because any and everybody can use carnosine, and the injectable aspect of BPC is going to knock out a lot of people. The other thing is, where are they sourcing it from? Because if they're not getting it from a good pharmacy, the majority of BPC 157 right now is they procure it from gray sites, or not intended for human use sites. And so you have to, you're supposed to use it for your lab animals. So a lot of people that you don't know if you're getting what you're actually paying for. So I personally wouldn't inject myself with anything that comes from a research lab, unless it comes from a licensed pharmacy. And that's the majority of people that are getting BPC 157 are getting it from gray site or peptide site. So it's kind of a gray area in medicine.
Mhm.
But it's over the counter. It's accessible to everybody. I saw,
So easy
yeah,
to use,
easy to,
easy to
it's
apply.
topical. You don't have to learn how to use it. You just put it where it hurts.
Yeah.
I saw a question really quickly on the side about toddlers and things like. I would have no issue using it with a toddler to a small child. To the thing about it is that you got to understand that carnosine is very, very, very prevalent. We're not introducing something that is not already naturally occurring in the body. So carnosine is very, very, very prevalent in younger and younger children. So they already have a high amount of carnosine, which is why we say all the time, it's like, think about a 10-year-old, right? A 15-year-old. Like they can run all day, play all day, and they'll never come to you and say, I'm sore. It just doesn't happen. They can do dance, they can do, all kinds of, sports, and they will not say that they're sore because they have a high amount of carnosine. As we enter our teens and our 20s, we start to dramatically see a drop off in carnosine, which is why we start to get, more sore and things like that. So we're not introducing anything that's not already naturally occurring. So I would have no issues if somebody said, "Can my 5-year-old use it?" I mean, yeah, I mean, there wouldn't be any issues with it. It's not going to cause anything negative. It may or may not help, the younger, depending on his age. But yeah, if there's an injury or something like that, if they have an injury, but they're not going to have the same itises that say a 50-plus-year-old has, and that's where we've seen it, right? We always talk about I myself was using it mainly for our athletes initially. Now, like there isn't a single patient that I don't feel would benefit from it. I see it's mostly our 50-plus-year-old people that have pain, and those are
Yeah.
the people that are using it every single day.
So if anyone watching this, if you've got an itis of any kind or someone you care about suffers with all the things that itises bring, just try it. That's why we're here. That's why we're doing these education sessions. And Dr. V, I just really appreciate your time educating me and everyone that's watching about the incredible benefits that this gel is bringing to so many people around the world. Thank you to everyone that has been tuning in from everywhere, and we see your questions. If we haven't got to it, we will in the future, so keep asking. We've run out of time for now. Next week we have a very special guest. We have Chad Marcius. Chad is a two-sport Olympic athlete turned molecular biologist. He launched the Human Kinetics Institute. I'll just play this video. Maybe that's not working. He launched the Human Kinetics Institute, and he's begun working as the performance coach. He's done plans for the Navy SEALs, and this guy just absolutely knows his stuff. So if you tune in this time next week, we'll have an in-depth conversation with Chad. Thank you so much, Dr. V. Thank you so much to everyone that is watching. We truly appreciate you being part of our mission to spread the wonders of this miracle molecule to the world, because you may have first heard about it here, but you will hear about this more. And just reach out to the person that's told you about carnosine, and they'll introduce you to more information and can help you get your hands on some too. Thanks a lot, Dr. V. We'll see you soon. Bye, everyone.